So I want to tell you a story. I want to tell you a story about how a skinny Haitian chicken and a bowl of beaten cabbage soup helped me turn my world upside down and think differently about how we might solve the problem of chronic diseases, this crazy explosion of heart disease, diabetes, and obesity that I call diabesity. How can we even think about solving a problem that's going to cost $47 trillion over the next 20 years, that by the end of this decade, we'll kill 50 million people a year, killing twice as many as infectious disease? How do we think about a world where now there are more people who are overweight than are starving? How do we think about a world where there soon will be 500 million diabetics and almost 1 billion pre-diabetics and only a fraction of the healthcare practitioners and doctors we need to take care of them? These are not just problems of affluence. These are exploding in the poorest countries on earth. So what does a skinny Haitian chicken have to do with rethinking how we approach chronic lifestyle-driven diseases? Well, my rethinking started on January 1st, 2010, the first day of this new decade. And I just finished a book by Paul Farmer, who successfully tackled the worst diseases in the worst places on the planet. Paul successfully treated TB and AIDS, which everybody thought were untreatable in the face of extreme poverty in places like Haiti or Lima or Rwanda. Paul realized we didn't need a new advance in medication or a new advance in science, but something very simple: to rebuild community and connection in broken communities. Paul's genius was his insight that the key to solving insoluble healthcare problems was each other, was people helping people, or peer support. Pierre's genius was the idea of accompaniment, of accompanying each other to health, helping each other build back their communities with clean food and clean water, going to each other's houses to make sure their sick neighbor knew how and when to take their medication. And it wasn't just a better delivery model for the right drug or the right information. The community was the cure. The community was part of the medicine. That was how I spent my first day of this first year of the new decade, an auspicious day. And I was thinking about how Paul's insight about infectious disease might help us solve this epidemic of chronic diseases like heart disease and diabetes. And as this idea was shaking up my thinking and my head, a disaster happened. That massive earthquake hit Haiti on January 12, 2010. And 2 days after that, I arrived at Sunset with Paul Farmer, who I called because I figured he'd know where to go. And I asked him to come with us, and we went on a small plane with a small medical group, and we landed at Sunset. We arrived into the chaos and the devastation and the overwhelming suffering that was Haiti that day. We unloaded our plane and went directly to the main public hospital in Haiti. It was very intense. And after a week of 20-hour days amidst amputated limbs and amputated lives, I finally got to sit down and eat some skinny Haitian chicken with the director of the hospital, Dr. Alex Aseg. And as we had our first meal in days, and I tried to find some meat on that skinny chicken, I asked Dr. Aseg, what was the most common admitting diagnosis here in Haiti, in the main public hospital that served 8 million people before the earthquake? And I thought he would say TB, malaria, AIDS. But here in the poorest country in the Western Hemisphere, in one of the poorest countries in the world, it wasn't TB, AIDS, or malaria, it was diabetes, high blood pressure, heart disease, 90% of which is reversible through lifestyle. Those chronic diseases have reached every corner of the globe and touched everyone on the planet. It's you or someone you know or love. Most of these conditions, like heart disease, high blood pressure, many cancers, stroke, even dementia, are caused by the same root problem. The cause of the causes, as Sandeep said, it's diabesity. It's that continuum from a little bit of belly fat to pre-diabetes to full-blown type 2 diabetes. So I'm sitting there in this hospital building, this crumbling hospital building in Haiti, where the main admitting diagnosis was diabetes, thinking, how do we deal with this crazy, overwhelming problem of obesity-driven chronic diseases that are getting worse and worse and costing more and more, despite our best efforts to treat it with medication or surgery? How do we deal with the fact that diabesity will soon affect 1 in 2 Americans? That's pre-diabetes or diabetes. That's every other person in America. How do we deal with the fact that full-blown type 2 diabetes affects nearly 1 in 10 Americans, 1 in 5 African Americans, 1 in 4 Medicare patients, and that 1 in 3 Medicare dollars today is spent on diabetes? And that, my God, 1 in 3 children born today will have diabetes in their lifetime. And that 80% of the world's diabetics are in the poorest countries. And then almost half of all diabetics and almost all of pre-diabetics are not even diagnosed. So it was in the aftermath of being up to my elbows in blood and pus and broken bones and broken lives and broken hearts that I first understood what I totally neglected over the last 15 years of diving deep into systems, biology, and genomics. I was so hyper-focused on biological networks, on systems medicine or network medicine as the answer to solving the puzzle of chronic disease, on turning the dials on biology for individuals, that I missed something much more important. That most chronic disease is very often a social disease and not just a problem of biology. We know that you're more likely to be overweight if your friend's friend is overweight than if your parents are overweight. That the genetic threads that connect us may be less important than the social threads. That our social connections and our ancient need to be part of a tribe may be a way out of our chronic disease epidemic. That just maybe sociogenomics, or how social networks influence health and disease, or how social networks alter gene expression, is where we need to look for the solution. Now, in some places, people are talking about gastric bypass as a solution for diabetes, as if you could cut out a bad lifestyle like a wart. I mean, is this really a solution for our 400 million diabetics in the world at a cost of $300,000 a person or $12 trillion? We can't medicate our way out of a bad diet. I mean, taking a statin while downing a double cheeseburger, fries, and a soda just doesn't make any sense, right? But there has been one new drug that's discovered that can beneficially modulate thousands of genes, that can enhance the function of dozens of hormones and regulate tens of thousands of protein networks that Laszlo talked about. And it can even prevent, reverse, and cure most chronic diseases. And it works faster, better, and cheaper than any other drug, and it's available to everyone on the planet, almost everyone, right now, and it's food. We know now that food is not just calories, it's information, and you can upgrade your biological software with it. That the majority of chronic disease is primarily a foodborne illness, even cancer, as we learned from Otis Brawley. We ate ourselves into this problem, and we got to eat ourselves out of it. I mean, look, high cholesterol is not a statin deficiency. Diabetes is not an Avandia deficiency. It's not doing the same things better. What we're doing is not really working. It's like rearranging the deck chairs in the Titanic. I mean, statins increase the risk of diabetes by 48%. Avandia, the number one blockbuster drug for diabetes, has killed almost 200,000 people from heart attacks since it was introduced. So wait, statins designed to prevent heart attacks cause diabetes, and the drugs designed to treat diabetes cause heart attacks. This is Pharmageddon. So after I was in Haiti, I realized that the answer had to be somewhere else. I thought, if social networks can promote unhealthy lifestyles, maybe social networks can be used to create health. We know how to prevent, treat, and reverse diabetes and heart disease, so why don't we do it? Why have we failed so miserably at this? We can eradicate type 2 diabetes, just like Larry Brilliant helped eradicate smallpox. We may not be able to win the war in Afghanistan, but this is one war we can win. But people give up when they try to think about dealing with obesity and chronic disease that's killing most of the people on the planet. It's like too overwhelming. It's too big. But I don't think it is. I think it's a small problem. I think it's a local problem. I think it's a community problem. So after I came back from Haiti, I lay awake at night thinking, how are we really going to deal with this? And I thought, maybe we need to decentralize healthcare. We need to democratize healthcare. I realized that if you were sick, the best place to create health might not be the doctor's office or the clinic, but it might be your own community with a little help from your friends. I realized that getting healthy is a team sport, that we're better together. And then one day, I'm sitting in my office, and I found Pastor Rick Warren from Saddleback Church in Southern California coming in, wanting to get religion about health. Now, after his appointment, we went to dinner, and over a bowl of beet and cabbage soup, I asked him to tell me about his church. And being a Jewish doctor from New York, I didn't really know much about evangelical churches in Southern California. So he said, well, I got this church, 30,000 people. I'm like, 30,000 people? He's like, yeah. I said, every week we meet in 5,000 small groups. I'm like, 5,000 small groups? I said, wow. I said, this wasn't a mega church. It was thousands of mini churches. And the light bulb went off in my head. And I said, here's a chance to test out this idea of peer support for creating health for chronic disease. I said, why don't we put together a healthy living curriculum and deliver it through these small groups? And you know what Rick said? He said, yeah, let's do it. And he said, yes, do it, because he'd recently baptized 800 church members. And after about the 501, he goes, man, we're a fat church. he's like, wow, and I'm fat. He's like, we got to do something about this. So we didn't need a team of highly trained health experts, except in designing the program. And a little more than a year ago, with Rick Warren and my friends Dr. Oz and Dr. Amen, a Christian, a Jewish, and a Muslim doctor, which sounds like the beginning of a bad joke, not a health program, we launched the Daniel Plan, which is a social experiment to see if community support was more effective than medication or conventional medical care for reversing and treating disease and creating health. The Daniel Plan, which was named after Daniel the prophet from the Bible, who resisted the king's temptation of bad food, is a wellness program delivered through small groups in the church. We thought, oh, well, maybe a few hundred people are going to sign up. In the first week, 15,000 people signed up, and last year together, they lost 250,000 pounds. Thousands of people and many churches around the world have signed up from 189 countries. 6,000 people are not even in the church. In fact, I recently met with leaders in Atlanta from the church, and Bernice King, Martin Luther King's daughter, who said she thinks that disease is a form of injustice and that health is a basic human right. Echoing the call for justice that Byron Stevenson started us off with, she said that health is a form of nonviolence. Health is a form of nonviolence to yourself, and that she wanted to make this part of the King Center's curriculum on nonviolence. And our social experiment worked. We got biology to change by using the principles of functional medicine, the science of systems medicine, of network medicine, of dealing with the causes of the causes, as Sandeep explained to us, the science of creating health through lifestyle-based interventions that optimized our biological networks. But we got behavior to change by using community and the power of positive peer pressure and social networks. Not only did they lose 250,000 pounds, but they also used less medication, many stayed out of the hospital, and they didn't go to the doctor as much, and the program was free. Many people reported better energy, better mood, better sleep, better blood pressure, better skin, even better sex drive. One guy told me he was in the hospital 4 times last year and on 9 medications. Now he's only on 1 medication and stayed completely out of the hospital. People lost 125 pounds, 90 pounds, 80 pounds. The slackers lost 30 pounds. They got off their insulin, their diabetes medication. It was like a gastric bypass without the pain of surgery, vomiting, and malnutrition. And those who did the plan together lost twice as much weight as those who did it alone. E.O. Wilson, who says in the book that we all got today that the social conquest of the earth is partly because that it is our drive to join a group that makes us human. It is the longing to belong, and the power of peer pressure can be a force for both good and evil. It can drive war and violence, or it can be a force for healing. So here is the big insight for me. The community was not just a delivery system for health education. The community was part of the cure. The group was the medicine. So what did we do? Well, we created this interactive curriculum. We delivered it through multiple media, online education, videos, articles, recipes, webinars, all done in small groups, community events. We did this at Saddleback by changing the culture. Pastor Steve, who was born again, who was serving ribs and donuts for breakfast, became a health champion. And he grabbed donuts out of the mouths of the men in his small group. Over 1,000 people showed up and volunteered to be health champions for their group. We changed what was served at Bible breakfast, the menus in the refinery, what people served in their homes and their small groups. People learned to create health together, to shop, cook, eat, exercise, and play together. We didn't treat disease. We didn't create a weight loss program. Disease went away as a side effect of creating health. We taught people self-care, and combining that with caring for each other, we created a small miracle, something healthcare or healthcare reform has not been able to achieve. I think this is the seed of a bigger possibility. In every home, in every community, in every school, in every workplace or faith-based organization, there are health champions waiting to be asked to show up and help each other take back our health. We have a vision to scale this to 1 billion people and turn healthcare upside down to democratize and decentralize healthcare. And this is possible not just in rich countries like Peers for Progress, which created pilot programs in the poorest countries to treat diabetes in Cameroon, Uganda, Thailand, and South Africa based on peer support. The peer support group models in Africa, in these countries, were more effective than conventional medical care for improving the health of diabetics and decreased healthcare costs tenfold. So, after that meal of the skinny Haitian chicken and the beet soup and cabbage soup, I thought, what if we could tackle this problem? Not one by one in the doctor's office or the clinic, but in the tens of millions in people's homes and churches and schools and workplaces. What if we could take the 36% of Americans who are not working but are eligible for work and create a health corps like President Kennedy's Peace Corps, our call to action, which Jay started TED Med with, that would be the equivalent of getting a man on the moon by the end of this decade, and create millions of community health workers to engage the world's latent health champions because they're out there. They're in every community, in every organization, of peers, of people helping people, like Rebecca showed us with Health Leads. People that with a little training has been proven to be better and more effective at treating chronic disease and the worst problems in our era. Maybe I thought, this isn't a medical problem like an infection or a broken bone. Maybe chronic diseases are social diseases and we need a social cure. Maybe it is the power of each one of us supporting each other that will help us all take back our health. Acute disease can be left to the hospitals, but creating health and treating chronic diseases, that happens best in the community with people helping people, where each one of us live, where we eat and learn and work and play and pray. That is where health happens. When I was at Paul Farmer's mountain clinic in Haiti, there was a plaque in French that said, "The happiest man is the one who makes others happy." An old African proverb says that if you want to travel swiftly, travel alone. But if you want to travel far, travel together. So let's all do this together. Thank you.